Perfect. You guys can hear me, right? Okay, perfect. Thank you. So today we are going to cover the cardiovascular system. Pin this real quick. Okay. So today we're going to talk about the cardiovascular system. So this is all about the heart. We're going to learn about the perfusions and the pathologies that can causes heart attack, peripheral vascular disease, and also issues with the arterial vascular diseases. So it's all about how's the heart pumping the blood, perfusing the blood to the body. So that's basically is today's chapter. Okay, so this chapter will have medication, of course, like any other chapters, but usually the medication in the cardiovascular chapters is what usually going to be on the test. So I really would really recommend you guys to study the medications hard, especially for this chapter. Next week, I will also do a medication review after the tutor session as well. So so that you guys can be prepared for your medication quiz for next week. All right, with that being said, we are going to go ahead and get started. Cardiovascular disorder and nursing care. Oh man, single page. Okay, so some of the important terms that we have to understand and know the definitions of this. The first one is the cardiac output. So cardiac is the heart and output is the volume. So basically cardiac output is how much volume is pumping out of the blood. Output, how much volume is pumping out of the blood every time it's beat. So the reason why it's associated with heart rate is because the faster, so fast heart rate or slow heart rate will affect cardiac output. So let's go back to anatomy. So in order for the heart to be able to pump enough volume, the heart has to rest. When it rests is when the left ventricle is being filled with blood, correct? So if the heart rate is too fast, that means that the heart does not have enough time to fill the left ventricle with enough blood to eject that volume out for the rest of the body. Therefore, a fast heart rate will reduces the cardiac output. And also, so when the heart rate is too slow, which is less than 60, is also affect the cardiac output because within 1 minute, the heart doesn't pump fast enough in order to produce the same amount of volume that it's supposed to do. So fast heart rate, which is more than 100, and low heart rate, which is less than 60, both affect cardiac output. It both reduces the cardiac output. Next, we have stroke volume. Stroke volume is how much blood the heart is pumping. So it's similar to cardiac output, but it's more about how strong, how effective the contractility of the heart is. So if it's pumping hard, that means that the heart is strong. Weak heart means the stroke volume won't be as great. So it's more about the contractility of the heart, whereas cardiac output is more associated with how fast and how slow the heart pump. You guys following so far? So that's the difference between the cardiac output and the stroke volume. Next, we have systemic vascular resistance. This is how much resistance is going through the body when the heart pumps. So if the heart pumps hard, if the heart pumps too hard and there's a high level of resistance in the aorta or any of the arterial or vascular of the body, it causes the blood volume to reduces. It causes the blood flow to reduces because the resistance is so high. So the more resistant, so what causes high resistance in the vascular system? Hardening of the vessel wall. So the vascular is usually, it can be stretched. So if it's hardened because of smoking, because of diabetes mellitus, because of obesity, or because of fatty high cholesterol, the hardening of the vessel wall will make the vessel less stretch. And when it's less stretch, it causes an increase in resistance when the blood is pumping against that blood vessel, and therefore reduces the perfusion to the rest of the body. Hypertension is high blood pressure. High blood pressure also increases the resistance when perfusing blood to the rest of the body. CAD is coronary artery disease. So this coronary artery disease is basically, there are small little plaque, also known as atherosclerosis. These are accumulated fat in the blood vessel that clot and make it make the road for the blood vessel so narrow that it's hard for the blood to pass through that blood vessel and perfuse the rest of the body. So, and diabetes mellitus causes weak blood vessel. So these risk factors are what causes, or what can make the resistance in the vessel increases, and therefore reduces the perfusions. Okay. So the job of the heart is to pump blood to the aorta and to the rest of the body in order to perfuse the organ, to perfuse our extremities, to perfuse our brain and all of the tissues in our body. However, if there are such high resistance causes by hypertension, all of these pathologies that I just mentioned, it reduces the perfusion. So that's the basic of it. Okay, so now we're going to each one. So now we're going to cover hypertension. So like I mentioned earlier, hypertension is basically high blood pressure. So high blood pressure is systolic blood pressure above 140, and diastolic blood pressure is above 90. Regular blood pressure is 120/80. That is normal. But when blood pressure reaches over 140/90, that is considered hypertension. And like I mentioned earlier, hypertension is not good. It increases the resistance in the vascular system, and therefore reduces the blood that being perfused to the rest of the body because of the high resistance. So factors that influence hypertension, that meaning what causes hypertension: too much fluid. So too much fluid inside the body can increases the blood pressure as well. So for example, if you pour 1 liter down, the pressure of 1 liter compared to when you're pouring 10 liters down, the pressure is different. So when you pour 10 liter of fluid down, the pressure of 10 liters of fluid is significantly higher than the pressure when you pour 1 liter of fluid down. So that's why too much fluid in the body can increases the blood pressure and therefore reduces the perfusion of the body. Increase renin-angioaldosterone stimulation. So basically, the renin-angioaldosterone stimulation in the kidney is what regulate the blood pressure. So aldosterone is a hormone that the kidney release, and when the kidney release excessive aldosterone hormone, it causes a retained of sodium, and when the body retains sodium, it retains water. And again, if there's too much water in the body, the blood pressure will increases, and it will lead to reduces in perfusion. And insulin resistant. Insulin resistant is basically diabetic type 2. the body cannot use the insulin in order to break down the glucose. Therefore, the blood is always filled with high sugars and lead to diabetic mellitus type 2 and causes weakness in the blood vessel and also increases the blood pressure. So diastolic blood pressure is more important. If it is high, it is bad because it is the measurement at rest. So this is the main indicator of the issues. So like I mentioned earlier, normal blood pressure is 120/80. Pre-hypertension is 120/139. 120 to 139/80 to 89. Hypertension stage 1 is 140 to 159/90 to 99. And hypertension stage 2 is above 160/100. So when someone have a blood pressure significantly like that, like in the 180/100 or 180/110, that's really serious, you guys, because when the blood pressure is too high, it can break the vessel, it can break the artery and causes a stroke and causes internal bleeding. So it's really, and also maybe seizure as well. So that's why blood pressure is really important. Is one of the most important vital sign that nurses have to check all the time. Low blood pressure is indicative of hypovolemic shock as well. And high blood pressure can lead to stroke. High blood pressure can lead to reduces perfusion, and high blood pressure can lead to internal bleeding as well. So you guys have to know these numbers because in the exam, she will give you guys the number like 160/100 and what stage of hypertension this patient is in. Okay. So early manifestation of hypertension is headaches because too much of the pressure reduces the perfusion to the brain and therefore it causes headache. Fatigue, dizziness, palpitation, butterflies in the chest. That's the feeling that the patient might describe. And then we have late clinical manifestation include organ damage because over time, high blood pressure, it reduces the perfusion to the organs. And when the organs is not receiving blood, is not receiving oxygen, or enough blood or enough oxygen, it starting to deteriorate and not function as good as it's supposed to do. Then we have PVD. PVD is peripheral vascular disease. It's relating to the peripheral, the extremity. Peripheral is the hands and the legs. So it just basically means that the hand and the legs does not get perfused because the blood pressure is so high. So the sensation is also diminished as well. And then we have retinal damage, damage to the retinal and the eyes. And then CHF is congestive heart failure. Congestive heart failure is basically the heart, because such high blood pressure over time, it's overworked the heart because the heart have to pump so much harder against that pressure in order for the blood to go out into the rest of the body. So therefore, over time, the heart, it's overworked and it get enlarged and it's starting to fail and it does not work as good as it's supposed to do anymore, and it doesn't pump out all the blood. It retains some of the blood and causes backup of the fluid. So I will explain more on that later. So, but these are some of the late clinical manifestation that the hypertension, high blood pressure can lead to. Late is caused by not managing hypertension as well. Okay, they usually said high blood pressure is the silent killer. So what are the goals for people who are hypertensive? So the goals is to teach the patient about monitoring the blood pressure. They have to have a blood pressure cuff at home and continuously monitoring the blood pressure every day or before and after they're taking medication. They have to follow a low salt diet, low sodium diet. Why? Because like I mentioned earlier, wherever the salt goes, water follows. So if we retain too much water in the body, the blood pressure will also increase as well. So these patients have to follow a low salt diet. Then low fat diet. Why? Because earlier I mentioned about atherosclerosis. These are accumulated fat that can clot the blood vessel. And if the blood vessel is clot, it can it can narrow the passage where the blood flow and therefore increases the blood pressure as well. Then these patients have to continuously exercise and manage their weight. Smoking cessation. Why? Because when someone smoke, it causes inflammation of the blood vessel. The blood vessel is the passage where the blood can flow through. And if we continuously smoking for a long period of time, these blood vessels started to inflame and it's narrow. It's also known as vasoconstriction, which means that the blood vessel started to constrict and the passage that for the blood to flow through is smaller. And when the passage for the blood to flow through is smaller, it causes increase in blood pressure. So as a nurse, we have to teach the patient to continuously monitoring their diet, exercise, and watch out for signs and symptoms of medication. We have to teach them how to take their blood pressure and teach them what is the correct number or what is the number that indicative of their situations. So when do we call the doctor? We have to call the doctor if we have to teach them to call the doctor if the blood pressure is more than 140/90. Important thing to note about specifically elderly patient is they are more sensitive to medications. They are more sensitive to the volume depletion of diuretics and might have more side effects. So diuretic is a medication. Diuretic is the medication where when we take or give that medication to the patient will starting to pee a lot more so that they can reduces the fluid inside their body and therefore reduces the blood pressure. So that is why we give diuretic. Part of if the cause of the patient is fluid volume overload that leads to hypertension. Okay, so drug therapies in hypertension. So earlier I mentioned a little bit about diuretic. So let's go a little bit deeper in this medication, in this class of medication. So diuretic use, so when we treat hypertension, we usually start the patient with diuretic and they have thiazines, loop, and potassium sparing. So let's look at this first. So typically start with diuretic. Lasix is the most common. So Lasix is another name for the generic name for Lasix is furosemide. So this medication is important to remember. Okay, I repeat one more time. Furosemide, Lasix is one of the most common medication that is used for patients who have fluid volume overload and also hypertension. Okay, why do we give this medication? This medication is in the diuretic class, and diuretic promote the patient to pee a lot, and when they pee, they reduces the fluid retained in the body. One thing to note about this medication is it can causes an excessive amount excretion of potassium. So when we give them Lasix or furosemide, when they pee, they not only excrete the fluid, but they also excrete the potassium inside their body. And therefore, these patients are also at risk for hypokalemia, meaning low potassium level. So when we give furosemide or administer furosemide to the patient, we have to check the potassium level. What is the normal potassium level? 3 to 5. If the potassium level is less than 3, we have to hold the Lasix or furosemide medication because it can causes issue with the heart rhythm if we don't hold the medication. If we give straight to the patient, it will further reduces the level of potassium in the patient. Okay, and all of the blood pressure medication we give to, and any medication that reduces blood pressure is put the patient at risk for something called orthostatic hypotension. And this is when the patient in a lying position and moving to a sitting position and they experiencing dizziness. That is called orthostatic hypotension, and all of the blood pressure medication is putting the patient at risk for that. So what do we do in that situation? We tell the patient to hang their feet over the bed, dangling it a little bit for about 2 minutes, and then ask them, reassess them to make sure that the dizziness is going away. But orthostatic hypertension is another side effect for all of the blood pressure medication, okay? So next, we've moved on to beta blocker. Beta blocker is a medication that reduces the heart rate and also the blood pressure of the patient. And these medication end in OLOL. So do not administer if the heart rate and blood pressure are too low. So we never administer beta blocker medication if the heart rate is less than 60 and if the blood pressure is less than 100/80. Okay, next we move on to calcium channel blocker. So this medication is also a blood pressure medication. However, it typically used to control the patient with angina. Angina is another word for chest pain. The side effect for calcium channel blocker is it can cause bradycardia, meaning low heart rate, and also hypotension, meaning low blood pressure. So we have to watch out for orthostatic hypotension. Like I mentioned earlier, all of the blood pressure medication can lead to orthostatic hypertensions. So we have to acknowledge that and as a side effect. Then we have ACE inhibitor, and these medication and in PRIL, like you guys see, PRIL, PRIL. And this medication is also a blood pressure medication. However, there are some side effects. It can cause dry and non-productive cough in the beginning. If lasts then more than 2 weeks, then we have to call the doctor and maybe change the prescription for the patient. All right. So earlier I mentioned about diuretics. So these are some of the subset of the diuretic. I talked about furosemide earlier, so we're not gonna, we're going to go over it, but let's focus on thiazide first. Thiazide is also known as hydrochlorothiazide. So this medication is a subset of the diuretic class, and this medication should only be given with adequate renal function, meaning that when we give this medication, we have to check the level of BUN and creatinine, right? And we have to avoid in patients with poor renal function, meaning that they have chronic kidney disease, acute kidney disease. We don't give this medication because this medication requires the patient renal function is to be optimal in order to administer. This medication works in the kidney, so always assess potassium level as well. And then earlier I mentioned about furosemide. Furosemide Lasix is the loop diuretic, and it is potassium wasting. Like I said earlier, when we give them furosemide, when they will pee out a lot of fluid, and when they pee out a lot of fluid, they excrete a lot of potassium too, so they at risk for hypokalemic. And then if we give the furosemide or Lasix too fast, they can cause an issue with the ear, where it causes ear clogged feeling or tingling in the ear. Okay, so those are the side effects of this medication. So when we give furosemide, we have to monitor for potassium level. DICT level is digoxin. We'll talk about that later. Adverse effect of this medication is dehydration because the patient peeing a lot, so they're at risk for dehydration. Hypertension, low blood pressure, because this is a blood pressure medication. So if we give them too much, it can severely lower the patient blood pressure and it can cause us hypotensions. And also it can cause us hypokalemia. This is wrong. It is supposed to be hypo. Okay, now let's move on to potassium sparing. Potassium sparing is another class of blood pressure medication, but it's also a subset of the diuretic class. So potassium sparing is completely opposite with potassium wasting. Potassium sparing is also a diuretic medication. However, instead of excreting the potassium when the patient pee, this patient will retain the potassium level and they only pee out the fluid. And this medication is known as spironolactone, aldactone. So we have to teach the patient to avoid sodium substitute because in sodium substitute, there are a lot of potassium and we already retain a lot of potassium level in the body. So we don't want to teach the patient to eat more potassium. We have to tell the patient to avoid potassium supplement again, because we retain potassium level in the body. We don't want any more potassium from outside resources. We're not losing any potassium because this is a potassium sparing diuretic and we avoid food that high in potassium as well. All right, so this is just a picture for you guys to look at for the medication later. So other intervention that we can do for hypertension is decrease sodium. Weight is most sensitive indicator of fluid volume overload. That means that if the patient having a lot of fluid in the body, we give them diuretic, they pee out a lot of fluid, and then we weigh them again, and their weight is lower, like 2 pounds or 3 pounds over 2 or 3 days, and that's good. That means that we evaluating the medication effectiveness and the medication works. Fluid restriction, because these patients are in a state where they retain a lot of fluid in the body, causes high blood pressure. And so therefore we don't want to give them more fluid to further worsen their the blood pressure issues. Increased fluid will increase blood pressure. All right, so now we are going to move on coronary artery disease. So let's break down what does this mean. Coronary is the heart and artery is like the blood vessel, the artery. Artery bring blood, nutrients, blood, oxygen, blood to that tissues, to that organs. So coronary artery disease is the disease of the blood vessel of the artery that bringing the blood or nutritional blood or oxygenated blood to the heart. Okay, so the artery in that area is disease, is going deteriorating and is bad. So coronary artery disease, aka atherosclerosis, is because this atherosclerosis is the main cause of coronary artery disease. It is hardening of the artery, and it's also because of the fat that clogs the passage inside the arteries that reduces the narrowing the passage for the blood to flow through. Risk factor include genetics, cholesterol over 200, triglycerides over 150, LDL is the bad cholesterol over 160, and HDL is the good cholesterol that we want it to be high, so it should be over 140. But if it's less than if it's less than 40, it means that the patient is at risk for CAD. That is in female, and in men, if HDL is less than 50, this patient is at risk for CAD and also diabetes. So coronary artery disease is usually caused by fatty plaque buildup, and this is also known as atherosclerosis. Diabetes mellitus, because they cannot break down the fat, they cannot break down the sugars, and therefore the blood vessel is always filled with sugars. High level of sugar can damage the blood vessels. So it can cause scarring, and this scarring will be a place where the fat will be stuck into and causes and build up a big clot where the blood cannot travel through anymore. Risk factor: LDL too high, HDL too low, caused by poor treatment to our body. Okay, so this is the picture of a artery of a blood vessel. So you guys can see if we have like a scarring causes by damage to the blood vessel, maybe because of the high level of blood sugar from diabetic patient, these can cause scarring. And in our blood vessel, guys, the fat we eat, it constantly flow through the blood vessel, and if it get caught into the scarring, it can start build up and build up and build up and causes a clot where the blood no longer be able to travel through that blood vessel anymore, and then we may have a heart attack, we may have a stroke. That is the basic of it. So it causes decreased perfusion, which can result in poor pulses and can result in pain and neuropathy, meaning no sensation of that area. The narrower the artery, the higher the blood pressure will be, okay? So how do we manage coronary artery disease? So it's really similar, guys. It's all about diet. So low sodium, low fat. We have to monitor the blood pressure, and we have to eat a healthy diet and exercise. Nutrition: avocado help lower LDL. Eggs are high in cholesterol. Regular butters are high in cholesterol. We want polyunsaturated fat. So saturated fat is bad. Those are like beef patties or like regular oil. Anything that frozen over time, the oil wise, or becomes solid. I mean, those are saturated fat. But when we see avocado oil or olive oil, they never get solid. They never become solid. So those are unsaturated fat, and we want them. So avocado will lower our LDL, and which is good for preventing atherosclerosis inside the body. So drug therapy for CAD, because one of the main causes of CADs is atherosclerosis, basically fatty buildup. So we give them the medication, lipid lowering drugs. So these always end in statins. And action is break down fat. All statins are toxic to the liver. Give at night because this is when the liver works best, okay? Antiplatelet medication. This is low dose aspirin, 81 milligram Plavix. This is because we want the blood to thin a little bit. And when the blood is thinner, they can flow through this, this narrower passage easier. And it reduces the blood pressure when the blood is thinner as well. So that's why we give them a low dose aspirin of 81 milligram. They usually call them baby aspirin. However, if we give someone antiplatelet medication or anticoagulant medication, they are at risk for bleeding, because if they have a cut, they will take longer for them to stop the bleeding or coagulate. So that's why they're at risk for bleeding. And the thinner the blood, the easier it can flow through the obstruction. So that's the reason why we give this medication for the patients. Okay, so far, anyone have any questions? Am I going too fast, or is anything not making sense? I know it's a little bit sleepy. No? Okay, thank you. Well, I'm going to move on to angina. So angina is just a fancy word for chest pain. And when do we get angina? Because the blood is not perfusing to the heart, or the perfusion is not adequate. So that's why we have a sensation of the pain in the chest, because the heart is screaming to get me enough oxygen, because I'm the most important organ in the body. One of the most, actually. Okay, so when the patient is complaining of chest pain and they are diagnosed by a medical doctor that they have angina, they will be prescribed nitroglycerin. Nitroglycerin is a medication that given to patients who have angina. And it's so incredibly important for you guys to know this next consideration, this next nursing consideration of this medication, because it will be follow you guys everywhere. So nitroglycerins, we have to know where this medication can be stored. Nitroglycerin can be stored in a dark bottle to protect from the light, dark or amber bottle, okay? Once you open the bottle, it is only good for 6 months. Nitroglycerin can cause headache and tingling. If nitroglycerin is given IV, severe headache will occur because of the fast effect of vasodilation. What is vasodilation? Vasodilation is the dilation of the blood vessel. Because this angina is caused by hypertension or constriction of the blood vessel or obstruction of a atherosclerosis in the blood vessel. Therefore, we want to give this medication so that the blood vessel can dilate and open up, so there's more space for the blood to flow through in order to perfuse the heart. Nitroglycerin can be is given sublingual as first. What is sublingual? Put under the tongue at the first sign of MI, which is heart attack, myocardial infarction, and then every 5 minutes. Erectile dysfunction medication are contraindicated because they both vasodilate and cause severe hypertension. So what does that mean? So someone who have an erectile dysfunction issues, they may be prescribed medication that can promote erection by dilating the blood vessel in the private area, in the genital area. So if they taking that medication and we also give them nitroglycerin, it can cause a severe hypotensive episode, and we don't want too low blood pressure, because if there's not enough adequate pressure in the body, the blood will not be able to push to the brain. Okay, so no nitroglycerin for someone who taking erectile dysfunction medications. If exposed to light, nitroglycerin can cause the medication not to be effective. So that's why we want to store them in a dark place, put them in an amber bottle or dark bottle, and maximum is only 3 doses. Someone who have erectile dysfunction and taking the medication for that and also taking nitroglycerin, they can literally fall to the ground and pass out because of the hypertensive episode. Also, for nitroglycerin, remember that we take them every 5 minutes apart and maximum only 3 times. Okay, so we take the first dose when we feel the chest pain. That's the first dose. After the first dose, the pain is still there. Immediately call 911, and then we take the second dose after 5 minutes of the first dose if the pain is still there. After the second dose, which we should have called 911 already after the first dose, while we still have the sensation of pain. After the second dose, we wait 5 minutes, and if there's still pain, we take the third dose of nitroglycerin. And that's it. Only maximum is only 3 doses. And hopefully by the time we take the third dose, we already arrive at the emergency department in order to prevent a heart attack. Okay. All right. So heart attack and heart failure are 2 complete different things. So you have to know the difference between them, and you have to know how to treat or just know the assessment of them. Heart attack is not enough blood going to the heart. Heart failure is the heart is not pumping enough blood out. Okay, do you guys want me to repeat that? Heart attack is not enough blood going to the heart. Heart failure is not, the blood is not pumping enough blood out. So heart failure, in fancy word, is the inability of the heart to pump sufficient blood to meet the body demand. Weak heart. Because the heart is weak and it does not pump all of the blood out, it can cause blood pooling. Blood pooling meaning after a contraction of the heart, instead of all of the blood in the left ventricle go out to the body, some of the blood is remain in the left ventricle and causes pooling. Over time, whenever the blood is pooling, it can coagulate, meaning it can thicker and coagulate and harden, and develop a huge risk factor for developing clots. And whenever we have a clot in a left ventricle or any region, any chamber of the heart, and when the heart contracts, this clot can be distributed over the aorta and to the rest of the body and causes issues such as stroke, okay, or ischemic stroke. And that is so dangerous. So that's why heart failure is also very dangerous. We have to know the difference between right-sided heart failure and left-sided heart failure. And it is so important, you guys. You guys have to know it. Have to know the difference between right-sided heart failure and left-sided heart failure and the assessment that comes with it, because it will be on the exam. Okay, so right-sided heart failure, the sign symptom will show in the peripheral area, will show in the neck region, will show in the arm, will show in the feet. Whereas left-sided heart failure, the sign symptom will be associated with the lungs. So let's go deeper. So if someone have a right-sided heart failure, they will show sign and symptom of swelling in the feet, hand, and abdomen. What is another word for swelling? Edema. These patients who have right-sided heart failure will have ascites, jugular vein distension, bulging eyes. Okay, so why does right-sided heart failure causes edema and swellingness in the peripheral area and bulging eyes and this crazy ascite stuff? Ascite is fluid in the abdomen, by the way. This is because, like I mentioned earlier, heart failure is the heart is weak. It does not pump effectively. So right-sided heart failure, where does the right side of the heart pump blood to? The right side of the heart pump blood to the lungs, correct? But if the right side of the heart is weak, the blood is not adequately pumped to the lungs and it causes pooling in the right ventricle of the heart. The pooling of this blood will then back up to the rest of the body. Therefore, it leads to swelling in the feet, swelling in the hand and abdomen. Whenever there are blood pooling, it will causes back up fluid and causes clots. So those are the two things when you guys hear the word blood pooling. Blood pooling will causes back up fluid and causes clots, okay? Now moving on to left-sided heart failure. What are the sign symptoms? Shortness of breath, crackles, bronchi, diminished lung sound, absent lung sound, capillary burst, bleeds, cough up, pink, blood, ting, sputum. Why? Because the lungs is filled with fluid. This alveoli is filled with fluid to the point where it's burst and causes bleeding internally in the lungs, and this patient coughing up blood from the burst alveoli. Why the left-sided causes these sign symptom in the lungs? It's the same concept. Because the blood is pulling in the left ventricle, it's causing backflow of fluid back into the lungs. Because how does the left ventricle get the blood? The left ventricle get the blood from the lungs, travel to the left atria and to the left ventricle, and then the left ventricle pump out to the rest of the body, correct? So that's why it's called it blood back up into the lungs and lead to all of these signs symptoms of fluid overload in the lungs. So one of the treatment is thoracentesis. This is when they literally put a needle, a big needle in, and remove the fluid out of the lungs for the patient. And because they put a needle in, so this patient is at risk for pleural effusion, meaning like the lobes of the lung is punctured by the needles, so they can get so that's why they're at risk for pleural effusion. But thoracentesis is one of the treatment that they use to remove some of the fluid out in the patient lungs so that they can breathe normally. Okay, thank you. So these are just some pictures that we have, so you guys can take a look. Right-sided, left-sided. It's really important to know the sign, symptom, and the assessment for these two, you guys, okay? Heart failure, the goal is to reduce preload and afterload and enhance contractility. Preload is everything before the heart. We don't want too much blood going to the heart, causes an increasing workload for the heart. And afterload is the resistant, the blood pressure. We don't want the resistance too high. So that is why we want to reduce the preload, reduce the volume that blood going to the heart, and reduce the afterload, meaning reduce the pressure, reduce the resistance that the heart has to pump against in order to get the blood to the rest of the body. And we want to enhance contractility, meaning that we want the heart has to pump effectively in order to get a good cardiac output and stroke volume out to the body. We want to improve oxygenation. We want to give them medication. And one of the major nursing diagnoses for heart failure is fluid volume overload, because these patients have backed up fluid. If they have right-sided, they back up to the body. If they have left-sided, they back up to the lung. So fluid volume overload is the major nursing diagnosis that someone who have heart failure. What is preload versus afterload again? Sure, preload is the total volume of blood that go into the heart. So the blood go from the superior and inferior vena cava to the right side of the heart. Those are called preload. And we don't want the preload to be too high, meaning we don't want too much blood going to the heart, because too much blood going to the heart causes the heart to have to work harder and pump harder. And if the heart have to pump so hard, it can lead to weakening of the muscle and causes heart failure. So that's why we want to reduce the preload. And afterload is the resistant. Resistant is, like I mentioned earlier, is the pressure that the heart had to pump against in order to get the blood out to the rest of the body. We don't want the resistance too high, because if the resistance too high, the heart have to pump so much harder than the resistance in order to get the blood out of the body. So that's why we want to reduce preload and afterload in order to prevent heart failure. You're welcome. So when we learn about in nursing school, morphine is a analgesic, is a opioid medication. So opioid medication is not supposed to give to patients who have difficulty breathing. However, in this case, for example, when the patient having left-sided heart failure and they have trouble breathing because their lung is full of fluid, we still want to give them morphine IV, because morphine IV can help this patient reduce his anxiety and improve the oxygenation, because morphine IV can also help dilate the vessel in the lung and help the patient to breathe easier. So that's why we give them morphine. Just a side note. Okay, heart failure interventions. So we have to know what are the fluid overload intervention. Really easy. Diuretic. Diuretic helps the patient pee, so reduces the fluid in the body. We restrict the fluid, right? It's overload in fluid already. That's why we want to restrict fluid. We monitor the labs and electrolytes. We check the potassium, sodium level. Hemodynamic monitoring is basically another fancy word for taking vital sign, monitoring blood pressure and heart rate. Stress management, we don't want them to stress. Stress can increase blood pressure. We want them to prevent infection. We give them medication, educate the patient to exercise, have appropriate diet, low sodium diet, low fat diet, avoid temperature extreme, too hot or too cold, and wait 1 to 2 hours after eating for any activities, and pace activity, meaning that have activity and then rest and then activity, not continuously doing anything for a strenuous over amount of time. For fluid overload, we have to daily weight them to make sure that they're not increasing in weight significantly in one day. We need to check the INO, intake and output, measure their urine output to see how much urine they're putting out. We give them a low sodium diet, fluid restriction, check the lung sound, all that jazz. Now we are moving on to aortic abdominal aneurysm. So the aortic abdominal is a really big artery that right here inside in the body. So it's a major artery that perfuses the blood to the rest of the lower body. And because it's so big and so it's usually really have high risk of something called aneurysm. Aneurysm is basically a pouch. So this is a blood pressure. This is a blood vessel. An aneurysm can be a pouch next to the blood vessel, and this pouch, if the blood pressure is too high, it can burst and causes internal bleeding. So that's why we have to learn about it. So aorta is the perfusion vessel to the top of the body to the bottom of the body. Aortic aneurysm, the patient can die immediately because it is where all the blood perfusion is happening. Occur due to weakening of the wall, due to hypertension, too much pressure. Primary cause of aneurysm is hypertension, atherosclerosis, infections, syphilis, HIV, genetic ties. How do we assess? These patients will have a very deep chest pain and they feel like the abdomen wall is ripping or tearing. There will be a palpable mass in the abdomen. Collaborative care. So the goal is to prevent rupture. That's the primary goal. We don't want that aneurysm to rupture because the moment they rupture, this patient will be in significantly hypovolemic shock and they can die because of the blood loss internally, the bleeding inside. And we have to detect the aneurysm early so that we can maybe cut or catheterize the aneurysm. We want to prevent the rupture by controlling the blood pressure and controlling the cholesterol. Okay, so now let's move on to peripheral artery disease. Peripheral is extremities, legs, arms, those are peripherals. Artery disease, meaning that the artery is deteriorating and there's not enough blood perfusing the peripheral. Peripheral artery disease is narrowing of the arteries, and when there is a narrow in the arteries, it causes low perfusion of the blood. Risk factors include hypertension, diabetes, atherosclerosis. To this point, I hope you guys remember already, like this risk factor of this disease is similar. It's the same thing. It's high blood pressure, diabetic, and high and fatty clots in the body. Clinical manifestation. Okay, so this is the most important term for you guys to take away from this slide because it will be on the exam and she will stress this in class, I'm pretty sure. So it'd be nice for you to know before she talk about it or when she asks in class, right? Intermittent claudication. This is the hallmark symptom of peripheral artery disease. And what is intermittent claudication? It's such a fancy word, but it's basically calf pain. So these patients, when they start walking, they experience significantly pain in their calf, and they are known as intermittent claudication. Just calf pain. I don't know why they didn't call it calf pain, but intermittent claudication is what they call it. This is the hallmark sign of someone who have peripheral artery disease. Paresthesias, meaning numbness and tingling, cool extremity with diminished pulse, because the blood is not going there. So obviously it's cool, and obviously there's no pulse because there's the artery is there is jacked up. The blood is not able to perfuse to that area. Atrophy of the skin, loss of hair, shiny skin, thin, torn skin, capillary refill more than 3 seconds, feet down, red, and whenever they elevate it, it's white. That makes sense, right? Because when they put the feet down, the blood is able to go down easier. But if they put the feet up, the blood going back easier, and it's harder to go to the feet. So that's why it's white. So if you guys have the chance, when you guys go to clinical, touch some of the patient feet, like especially the diabetic patient, and you guys see all of this, they'll have their skin will be super cool, and there's no pulse. And when you check the capillary refill on their toes, there's nothing. Intervention, TAD hoses, I don't know what that is. Aspirin is the medication that thin the blood, so it helps to the blood to perfuse better. And pain worse at rest. So that's another sign for peripheral artery disease. So now we just talk about peripheral artery disease. Now we talk about peripheral venous disease. The difference between artery and venous is artery is bringing the blood to the tissues. The vein, the venous side, bringing the blood back to the heart. So if they have a deterioration in the vein, it will be harder for the blood to travel back to the heart. Compared to peripheral artery disease, it will be harder for the blood to go to the feet and perfuse in the feet, right? So venous is the blood stay there in the feet or stay there in the arm and does not come back in the heart. And that's why it causes peripheral venous disease. So it's important that you guys know the difference between PAD and PVD. PVD, varicose vein, is one of the really common in elderly patients. These veins are like worms veins, and they can sometimes they can be engorged because they are filled with, they're pulling the blood. The blood does not travel back to the heart. So the blood is pulling, and there's very varicose and very like twisted. Occurs superficial veins in the arms and the legs. They can have pain, tenderness, inflammation along the vein, redness, warmth, and look like a rope or cord. This patient usually at risk for deep vein thrombosis as well. Deep vein thrombosis is clots inside the vein in the legs, and these are really bad because they can obstruct perfusion and can cause a stroke if it's traveled to the brain, or can cause pneumonia, a pneumonia emboli if it goes to the lung, right? So occurs deep in the vein. And why does it cause thrombosis? I told you guys earlier, if then whenever the blood is clot, there will be issue with backup fluid and clotting if the blood is pooling, okay? And peripheral venous disease, the blood is literally pooling in the legs, and it's not being able to go back to the heart. So the blood is pooling over there in the legs. So it causes all these issue with backing off the fluid and also causes clots. And that's why it's leading to deep vein thrombosis. So tenderness involved in vein, calf, groin, and pain. Suddenly, unilateral edema. Unilateral is one side, and edema is swellingness. Okay. Varicose vein, one of the treatment is wearing compression stocking. Okay, so this slide is the slide I want you guys to really learn and remember. So please take a picture, highlight this, learn the assessment, learn the difference of these assessment of the sign symptom of PAD and PVD, because it will come up on the exam. Okay, so let's just go over them one more time. PAD, the blood is not able to perfuse to the feet. So one of the hallmark is intermittent claudication. And what is this? Calf pain. They will have no edema. No edema meaning no swellingness. Why? Because there's no blood pooling. It's just there's not enough blood going perfusing to the legs. So that's why no edema. No pulse or weak pulse. Why? Because no blood. No blood coming there, so obviously no blood, no pulse. No drainage because there's no blood. If there's a cut, nothing come out. I mean, there'll be a little bit of blood, but it's not as much as the PVD. They'll have round, smooth shores, and they'll have black eschar. Black eschar is basically dead tissues because of the ischemic, meaning no oxygen. And PVD is dull, achy pain, and they have lower leg edema. They have lower leg swellingness. The pulse will be present because there is blood, so the pulse is present. But however, they have drainage. The shore will be irregular with borders, and they will have yellow, slab, or ruddy skin. So the location of the sores for arterial is toes and feet, compared to the location of the sore in venous is ankles. Okay, so we made it, you guys. That's it for today. Next week will be GI disorder. I'll do that tutoring session, and then I'll do a medication review. So yeah, is there any questions so far? I hope it has been interesting, and I hope that it was helpful for the people who attended. Could you post the PowerPoint on Facebook? Yes, I will post the PowerPoint for you guys on Facebook. And I will post this on YouTube too. You're welcome. You're welcome. Thank you everyone for attending the tutor session. All right, if you guys have no other questions, feel free to leave, and thank you very much for everything. Is GI going to be the next exam? GI will be on the next exam, yes. So last week is neuro, today is cardio, and next week is GI. So there will be 3 chapters. Yeah.